Pharmacology notes. Today we will simplify how Alpha-1 antagonists affect the urinary bladder, especially helpful in conditions like BPH or Benign Prostatic Hyperplasia. The urinary bladder is mainly controlled by three key receptors. The number one is M3 receptors on the detrusor muscle that trigger the contraction for urination. It is normal physiology of M3 receptors. Then we have beta 2 receptors that help the detrusor relax during the urine storage. Okay, here is a diagrammatic representation of the beta 2. Then we have Alpha-1 receptor, especially in the internal sphincter, that cause the contraction to retain urine. I hope it makes sense. The mnemonic for understanding M3 make it move, beta relaxes, and Alpha-1 adds lock to the sphincter. So what are Alpha-1 antagonists? Alpha-1 antagonists are the drugs that block the Alpha-1 receptors, reducing the tone of the internal sphincter. Okay, so this make it easier to urinate, especially for the patient with enlarged prostate obstructing urine flow. Okay, here's a diagrammatic representation of the normal prostate and the enlarged prostate. Tamsulosin, Alfuzosin, and Doxazosin. So Alpha-1 antagonists, as I showed in the rectangular area, will block this Alpha-1 receptor. Okay, so blocking this Alpha-1 receptors leads to, at internal sphincter, leads to prevention of contraction. Okay, so it will prevent the contraction, which causes relaxation of the internal sphincter. The ultimate result, okay, so here is a blockage of this contraction. Okay, so no contraction will take place, hence the net result will be improved urine flow and reduce urinary retention. Okay, the side effects and the precautions for taking Alpha-1 antagonists include, that is, dizziness, orthostatic hypotension, retrograde ejaculation. So the precaution should be made that when these drugs should be taken at the bedtime to avoid sudden drop in the blood pressure in case of orthostatic hypotension. I hope it makes sense. So this is our mnemonic like alpha loxagate antagonist open it. I hope it makes sense.